it was becoming too complex to address the frontline essential worker situation. What complexities did you address, and at what point did they become evident?
The CDC, Center for Disease Control, gave us a broad list of quote-unquote essential workers. That broad list would have incorporated over a third of the population of the state of Connecticut. And along the way, they gave us a broad list of folks with comorbidities, those most likely to suffer health effects, and that represented about a third of the population. And it was broad in the sense that they said agricultural workers, and then we started hearing from landscapers and arborists, and then they said grocery workers. Then we started hearing from convenience stores and big box stores where they serve food. And then we started hearing from our folks at the vaccination centers saying, how am I going to identify that this is an essential worker, not just somebody saying they're an essential worker? Do I have to have a pay stub? That's, when we started seeing, people who were trying to end run that system. And it was at that point that we began to realize the aperture was so big that it was just going to lead, everybody feels good, I'm on the essential worker list, but you're going to be waiting 2 or 3 months to get that vaccination. And you saw websites crashing around the country, right next door in Massachusetts, for starters. So we thought we did better, narrowing the aperture, being very clear about who is eligible, being able to show up with a driver's license. 55 and above is very easy as a metric to track. And then in every 3 weeks, we'll be able to expand that to another age group.
So as you might imagine, and I'm sure we're not the only news group who got questions from our audience and our readers, people that were thinking they were going to be in the next phase who now have to wait a month, maybe even longer. What's the response you've gotten, and what's your reaction to that response?
I think the positive response is I know what you did and why you did it, and I didn't realize that I, as a 45-year-old, would be eligible in a month. They'd be in a month whether I made them eligible today or not, given the nature of the queue that you had in place. So I think people are fundamentally understanding. Let's face it, the CDC said, here's a list of essential workers, so a lot of people saw that list and said, great, I'm going to probably get vaccinated next week. So we've had to, explain what we mean, but we're going to start vaccinating people next week, start vaccinating people 55 and above. And to some of those younger people who say, boy, I wish I could be ahead of the line, but thank you, because I live with my grandparents, and I'm really glad they have a vaccine so I can go to work and know I can come home safely.
When did you make this? It's sort of, I think part of it is it came on people sudden. You, on Thursday at your second weekly briefing, said we're going to follow the CDC, we're going to come out with a list of the pre-existing conditions on Monday. So was this in the works prior to
No.
that?
No, I think as of Thursday, Paul, I looked at the CDC list and I said, all right, let's follow the CDC. CDC gives you pretty good cover, made some sense. Then we started looking at the comorbidities. It didn't include asthma. It didn't include HIV. It didn't include, all of a sudden we started hearing from people, why aren't I on that list? And then we realized that was close to 1 million people. And then certainly the hospitals. We said maybe the hospitals can reach out to the healthcare providers and say, you're eligible because you're in a particularly at-risk situation. They said, no, the cleanest way to do it, 55 and above, they are 2, 3, 4 times more likely to have a comorbidity. Keep it by age. So that answers both questions.
So then this was something that you came to a decision over this between Thursday and Monday's announcement. It wasn't something that was in discussion prior to Thursday's briefing.
We made the decision over the weekend, that's right.
Okay.
So are there options you're considering to sort of layer on top of this approach to get to the more vulnerable communities? Because that is obviously one of the criticisms, that certainly 95, 96% of fatalities will be in the age groups that will be covered, but there is data that does show that communities of color are not going to be covered by this, including many of them who are in jobs that expose them to the virus. So is there any potential for a parallel track or, again, layering on, and I know...
I don't think so.
No?
I'll tell you, I mean, everybody and their brother, I ended my chemotherapy only 13 years ago. I think once you start making exceptions, it gets really complicated. And more importantly, in 3 weeks, we keep opening the aperture. And everybody is pleasantly surprised that if the vaccine flow keeps coming the way we hope it is, they know that by, April 4th, 90% of the people have had that first vaccine, or at least the option.
But perhaps people will look at the teachers' unions advocacy on behalf of their members and say, well, look at them. They were persistent. They were consistent in their demands and in their advocacy on behalf of their members. So, maybe it will work for our group. I mean, do you expect to see, I don't know, pressure campaigns?
Well, not expect. I'll tell you, everybody has an advocacy group, and they've been knocking on our doors. They've been knocking on our doors for weeks. And it's not just the teachers. It was everybody who works in and around a school, including the janitors and the food service workers and the transit and everybody, paras, because I wanted to keep those schools open. I didn't want them shutting down. I didn't want one false positive and everybody had to quarantine for 10 days. I thought it was that important for our schools and obviously our child care.
And what about the economy? I mean,
And important for our economy as well, absolutely.
And Governor, on the subject of schools, another layer of the announcement yesterday was that the sidebar clinics, if you will, they'll be set up for educators.
Yes.
How will the state work with those clinics to make sure they have all the supplies and resources they need?
Same way as we're sort of doing it right now. In many cases, we work the local departments of public health. They'll target a school or a group of schools. If it's a bunch of small towns, we'll get a very good idea of the amount of vaccines they need and then roll them out starting as early as Monday.
One question on another topic. Senator Looney's proposal on the pilot payments to cities.
Yes.
Maybe some movement on it this week. What is your thought on that? Do you support that? If not, how would you address that issue?
Two pieces of that, I think. Senator Looney, I think rightfully thinks the pilot payments should be made more progressive, meaning those richer communities that maybe don't need the pilot payment quite as much don't get as much or even get less from as far as I'm concerned. And those communities most in distress and need, we prioritize them. They get, more. That said, we have very different ways of how we plan to pay for pilot payments. I mean, I've got a $100 million upfront over the next year or two, depending on what Joe Biden adds to the mix, that we can start making payments into our municipalities on top of the education money that we're going to be able to provide. And then by year 3, we ought to have the marijuana revenues kicking in, and I've said I'd like to see at least 50% of that dedicated to our municipalities.
To pilot payments?
Yes.
So your plan is to fund the pilot more, not 100%, but a better contribution?
Yes, I think that's exactly right, Sue. Is that it? Hey, thanks, everybody.